All right. Can everyone hear me? Nod your head. Okay, we are live on YouTube, so I'm going to get us started. Sorry about the short delay, everyone. Welcome to our media briefing for today, Wednesday, April 8th. It's hard to believe we've only been at this a month. I think for a lot of us, it feels like much longer than that. Just a quick housekeeping note. Some of you have asked if we are going to do media briefings on Good Friday and Easter Monday. The answer is yes. We are trying our very best to stick to our media briefing schedule because we feel it's very important information to share. So we encourage you to join us on Friday and Monday and whenever else you can, and we appreciate you sharing this important information. So I will now pass it to our speakers. Today we're going to have a statement from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, followed by a statement from Regional Chair Karen Redman. Just a note that our CAO Mike Murray is also standing by for to take questions if they're directed at him. So I will pass it over to you, Hsiu-Li.
Thank you, Bethany. Thank you, everyone. As we are still in the early phases of the pandemic, we have and will continue to see for some time daily increases in the number of cases. And sadly, we continue to see more deaths as a result of COVID-19. I would like to express my deepest condolences to the families and loved ones of those who recently passed, as well as to the healthcare workers whose care they were under. Before I talk more about our situation overall, I'd like to point out some things about our dashboard. One, due to the volume of cases, our dashboard numbers are current as of 7 p.m. the evening before. That's right up at the top when we talk about the dashboards. This does not mean the work stops at 7 p.m. Our hospitals, our long-term care homes and retirement homes, our public health staff, and all our partners in the healthcare system continue to work around the clock. We are continuing to work on managing cases and outbreaks. Anything that comes in after 7 p.m. the evening before will show up on the next day's dashboard refresh. So just to let folks know, the dashboard is not a real-time tool for reporting. It is meant to keep the community informed on the trends that we are seeing. And just quickly about the new epi curves, like all curves of this kind, there is typically a 1 to 2 week delay between when someone starts having symptoms, when they are then diagnosed, and then when cases are reported to us and then added to the dashboard. Therefore, the epi curves are dynamic, and the data for the last 1 to 2 weeks will continue to be updated on a daily basis. We have now bolded the explanation we had previously put about that dynamic nature of the curves underneath the curves, so that it will be more easily seen by people so they can understand. Now I'm going to go back to speaking about our overall situation. So in particular, I'd like to talk about the long-term care homes. So we are continuing to see more cases in long-term care and retirement homes, and more homes have at least one case. This is what we expected. It continues to highlight that this is a more vulnerable population to COVID-19. And it also highlights the importance of continuing the strict measures that have been put in place for these homes, as well as for the community. All that we are doing in the community also helps decrease the risk to these homes. So a little bit more information about what we're doing with long-term care homes. So detailed guidance has been provided for long-term care homes and retirement homes by the Ministry of Health. And public health is working closely with these homes to support them to implement this guidance. So for homes that are under outbreak, we stay in close contact with them and check in with them at least daily for the duration of the outbreak. Some examples of actions that have been implemented to prevent COVID from coming into the facilities include the screening of staff and visitors, as you know, seriously limiting visitors, as well as isolating new admissions, if they're allowed to come in. And examples of actions implemented to limit the transmission of COVID in these homes once a case has been identified include testing, isolation, use of PPE or personal protective equipment, stopping new admissions, having staff work at that facility only, stopping communal activities, and increasing cleaning. Now I'd like to talk a little bit about the upcoming Easter weekend. So as we approach the Easter weekend, it's a timely moment to remind us all of the need to stay at home and to continue to use physical distancing when we are outside of our homes. We know these are the most effective means to slow the spread of COVID-19. Easter is the time when many of us come together with our wider families, but we can't this year. Each of us will continue to have a personal role to do everything we can to slow the spread of this pandemic. So I'm asking all our residents who celebrate Easter, please only celebrate with members of your immediate family, those who are living in your household, and please check in virtually with other members of your family. This will be especially important. It will be especially important that we do not relax our physical distancing measures during the Easter weekend. Any relaxing of our measures will subsequently lead to more cases than we otherwise would have had, and a more rapid escalation of severe cases and deaths. In conclusion, I know the social measures that we have put in place are difficult and will only become more difficult in the coming weeks. Without those measures, we would have experienced an exponential, uncontrolled rise in cases, and our healthcare system would have been overwhelmed. The measures have prevented many more severe outcomes and deaths than we would have otherwise had. I sincerely thank everyone who is doing all that they can. While we need to continue these efforts for some time, I would like our residents to know that your efforts have made an impact, and everything we continue to do will impact and determine our future. Thank you.
Thank you, Hsiu-Li. All right, I will pass it over to Regional Chair Karen Redman for her statement. Go ahead, Karen.
Thanks, Bethany. I'd like to take a minute to recognize some regional residents will be celebrating various Christian Easter and Passover traditions this week and this weekend. It's going to be difficult to celebrate in a way we're used to, but it's important for everyone's safety that you try different methods of staying connected to loved ones and your spiritual community this year. I have a big family. We have 4 grown children and 5 grandchildren, and we are planning to celebrate Easter by having a Zoom meeting at the dinner table. I'm sure many of you are also tempted to visit parks and trails this weekend if the weather is nice, but the safest thing to do is to stay home. I'm sure many of you will also be tempted to visit parks and trails this weekend. Crowded trails, forests, and parks reduce your ability to maintain proper physical distancing. So do busy parking lots. If you're outside, always maintain a distance of 2 meters from other people. It's important to stop the spread of COVID-19. Remember, people spread COVID-19. I also want you to remember this weekend to avoid gatherings, to stay home as much as possible, practice social physical distancing, and continue to self-isolate. If you return from out of the country, you have been asked by public health to self-isolate, to stay home. And remember to wash your hands frequently. While you're at home, if you're looking for something to do, you can help us. You can help us make a history. Our community is going through challenging times, and we each have noticed ways in which our lives have been impacted by COVID-19 pandemic. It's a challenging time that we would like to support of our community, but we need help to flatten the curve. Sharing your stories is a powerful way for us to reconnect and for us to make sense of the world around us. The Region of Waterloo Museums, our libraries and archives are working on a pandemic project called Help Us Make History. They want our community to share their experiences of everyday life during COVID-19 pandemic as a record of this pivotal moment in our history. In the past, many of those everyday objects and stories have gotten lost after the fact. For example, our museums have no artifacts from the Spanish flu back in 1917, and it makes it difficult to learn from and understand those stories today. Stories are powerful. We share stories to make sense of the world around us, to learn from our experiences, and to help form plans for the future. Visit our Help Us Make History pages on our museum's website for more information. Thank you.
Thanks, Karen. All right, I'm going to open it up for questions now. First on my list is Kate from CBC. Do you have questions, Kate?
I do have questions. The first one I wanted to talk about, Dr. Wang kind of touched on it about when there's an outbreak, workers don't move from a facility. So like if there's one at a long-term care facility, has there been a larger discussion about including doctors, more PSWs, and saying you can only work at one rather than say doctors who have dual privileges at St. Mary's and Grand River?
Yeah, that, I'm sorry, could you repeat your question for me?
Yeah, for sure. Basically, is there any larger discussion happening in the region of preventing healthcare workers from moving between sites? So
Oh,
if they
larger
have
discussion, yes.
Yeah.
Well, what we need to do is to balance the benefits and the risks, because you know, in order to ensure that there are sufficient healthcare workers in our different facilities, there are some that work in more than one facility. If they're in an outbreak situation, no, there can no longer be movement. But if they're not, there can still be movement. That said, there are a lot of practices that are being put in place, even for places that don't have outbreak, to screen people that you may develop symptoms and to not have them work, and to take appropriate precautions. So, while we have this stricter measure of not allowing staff to move between facilities when they're in outbreak, we also still have to maintain some movement of staff in order to make sure that we have sufficient staff across different facilities. But yes, the larger issue, though, I think that you're maybe trying to get at is the fact that we continue to need to have personnel, healthcare personnel in these homes in sufficient amounts of them. And so, yeah, so, you may have noticed the government of Ontario yesterday launched this website or this portal rather, where people that are wanting to volunteer their services can be connected to those facilities that require more staff. So there are efforts going on to try to make sure that we can continue to have the necessary staff in our homes and facilities.
And along the lines of long-term care homes, there have been some stories that have come out that have said, if you have a family member in one and they're healthy, get them out. It's safer if you take them out. And I'm wondering if public health has a stance on that, whether you're encouraging that or if there's a stance.
For many of these people, these homes are their home. And what I can say is that, these homes are working very collaboratively with us to ensure that they implement the appropriate precautions, the very strict precautions that have been put out by the ministry. And we're there to help them understand them, We provide resources for them so that they can, that they can quickly, make reference to those resources and know what to do, and help them, when they want to communicate with their community, with their residents, their staff and their residents' families. Obviously, every family has a personal decision that they make whenever it comes to having family members in homes. Whether they're at home or in these facilities, we're doing what we can to try to minimize impacts of COVID-19.
Right. And one of the stories from my colleagues in Toronto today is talking about how Ontario is not testing at the rate of other provinces.
Mm-hmm.
And you've talked about before how there's priority testing. So healthcare
Mm-hmm.
workers, people in hospital, long-term care. For you on a personal level as a medical officer of health, would you like to see us do more testing in Waterloo Region if the province said go ahead? And do we have the capacity to do more testing?
Mm-hmm. So a couple of things. We've recently heard that we should be able to obtain more testing kits so that we can implement more testing, expand those groups that are being tested. The second thing is we've heard also from the province that the testing capacity should be there now when we expand testing, and the capacity in the labs to turn around those tests. And thirdly, we understand the province is working on new prioritized groups for testing in anticipation of this capacity to ramp up testing. So we understand that should be coming soon. We are awaiting that. And in the meantime, we are doing everything we can to try to access those supplies that we understand have increased. So we're not waiting around. We're doing work all the time to try to access those increased testing supplies and ready our system for when we can expand testing. And we know which groups the ministry wants us to expand testing to.
Do you feel that with the testing that's being done, you have a good understanding of the caseloads in Waterloo Region?
That's an excellent question, Kate. So the testing is not optimal, that's for sure. We're only prioritizing certain groups, which we know why, right? They're the most important groups to test in, but limited testing is not going to be able to provide us the full picture that would be ideal. That said, indicators like hospitalizations and deaths are not, dependent on testing. And so those are other indicators that we can continue to follow that also give us an indication of how things are progressing in our region. So, one of the things I'm always looking at and discussing with our hospitals in the region is, how many hospitalizations have they had? And we see that also with our dashboard, right? As a trend, and we see, we are increasing the number of people seen in hospitals, or rather there have been increases in the number of people seen in hospitals. There have been increases in the number of people that have required ICU. But again, what we're seeing at this point in time, at least, is that this increase is manageable. So that indication to us from the hospitals, is at least good in that way, and that we know, okay, we knew there were going to be more cases, but at this point they're still manageable. And the hospitals continue to work very hard to increase their capacity in anticipation of future needs. So with all those things together, we get a picture. But of course, if we could do more testing, it would be better.
Great. I'm going to end there because I think I took more than my 3. So thank you.
I was going to cut you off, Kate. Thank you for your questions. We have quite a few more media, so we'll try to keep this moving along fairly quickly. Damon from the Woolwich Observer, I'm going to pass it over to you.
There we
Can you
go.
unmute yourself, Damon?
Yeah, I got it. Okay, so I have 2 questions. I heard recently there's been a decision to open 2 more testing facilities and they're referral only. Why is that?
Okay, Damon, hi. They're not testing facilities, actually. So the people that are being tested are the prioritized groups, and they're continuing to be tested through the hospital-associated clinics. So the hospitals have set up clinics where people that are in those groups can be tested. What these community assessment centers are to enable people that have been assessed by their primary care practitioner or a practitioner in a walk-in clinic virtually or by phone, or they and the primary care practitioner feels that they cannot see these patients in person because perhaps they're only doing virtual care. But these patients should be assessed by a healthcare practitioner in person. And so that's why these clinics are places where these patients who require inpatient assessment can be seen by primary care practitioners, and then they can be assessed about is it they think they might have COVID and they can safely return to home, or they'll need to go to hospital, or maybe they have something else and they'll be treated for that something else. It's really, that is why it is by appointment, because it is by referral from another primary care practitioner. And these are not testing facilities.
Okay. And then my second question was if you had any advice on staying physically active and keeping your mind in the positive during all of
Yeah,
this.
no, that's a very good question, Damon. And of course, with the measures that we've recommended for our community, this is a very hard thing to do, right? We try to encourage people to stay home. We encourage them to try to exercise at home if they can. And if people feel that they need to run essential errands or they need to go out for some fresh air, then they can go out. We ask people really to limit going out to only when they feel that it is essential for them. And if they do go out, say they need to go out for a walk, don't go out in a group, go out by yourself or go out with the people that you live with in your home. And when you're out, practice physical distancing. Don't stop and start to chat with a group of neighbors. We all tend to do that. That's our natural nature. We're very social. So it is very difficult for people to always, be alert, but that's what we're asking and kind of constantly reminding people to do. And then, and if they go for a, if they go for a run, if they go for a walk, if they go for a bike ride, try to do it when there's less people. Try to do it so that, you're not around people. As Chair Redman said earlier, don't go to a place where there's going to be a lot of people. And we're really wanting our trails not to have congregates of people. And so try to limit where you can going out and try as much as you can to try to keep physically fit indoors if you can.
Okay. And then just one last question, if that's okay.
For sure.
There's been a recent rise in viral videos of people visiting their families. So family members that are in senior centers and they're standing at the windows and saying hello that way. Is that acceptable still?
Yeah. So we have to really, those are the strict measures that we've put in place for all homes in order to try to prevent COVID from coming into the home in the first place. So that's very challenging, obviously, for families, but it's something that we feel we need to do at this time. And it's definitely helping because COVID is transmitting in our community, and it's very, very easy for visitors to bring it in. And we've seen this in other places in Ontario, and we are starting to see this now as well. Once it comes into the home, it can easily spread. And so,
Karen,
sorry, I'll stop there.
Sorry about that. Karen, did you want to add to that? I saw you.
Thank you. Thanks, Bethany. Damon, just further to your question about the getting out and having exercise, I think it's really important to underscore that all municipalities recognize the mental health aspect of exercise and getting out. And we do not want to close the rails and trails, but we can't have huge parking lots where people drive and then decide that they're going to go en masse. The social distancing that we all practice will allow all of us to enjoy that. So it sounds like it's all very cautionary, but the reality is people need to figure out how they can keep that physical distancing. And if they want to use the rails and trails, to do it either in their neighborhood or at a time when other people aren't, because we don't want to have to close them. We recognize that it's something that really adds to people's mental health at this point.
Thanks, Karen. Damon, is that it for you?
That's everything. Thank you.
Great, thanks. I'm going to pass it to you now, Joanna.
Hi.
Thank you. Just wondering, Dr. Wang, you mentioned that testing would expand. What groups would those include then?
We don't know yet. So the ministry is working on, a strategy for expanded testing. We understand we should hear soon from them what that will be. You may hear at the same time we do, because there's everything going out in real time now. So we'll update you as soon as we get that information.
Okay. And can you tell us some more about the 3 deaths reported today? Like a bit, were they all?
Sure.
Men or
Yeah.
women ages?
Yeah. So they were persons who were hospitalized, who have been in hospital, and they were in their 70s or 80s, and they all had other medical conditions.
And can you tell me, were they men, women, or both?
I don't have that off the top of my head. Just gonna see, maybe ask a question and I'll see if I can get that answer for you.
Maybe for Mike, will there be more bylaw officers out this weekend enforcing the rules and making sure people aren't congregating and gathering or out in parks?
Yep. So we'll have, as we had last weekend, well, and all week, we'll have regional bylaw officers will be out, local bylaw officers will be out, we'll have public health inspectors out, and also Waterloo Region Police are available if other enforcement actions needed. So I think, as I mentioned earlier this week, we've issued warnings, we've laid charges. So we're taking this seriously, and we want the whole community to take it seriously. So yep, we'll be out and about actively enforcing all of the guidelines and regulations.
Okay, thank you.
Joanna, I got the answer for your question. So it's 2 females and 1 male.
Okay, thank you.
Okay, anything further, Joanna?
No, that was it. Thank you.
Great, thank you. Okay, so I'm going to pass it now to Ben from 570. Can you hear me, Ben?
Yep. Thank you very much. This question's for Mike Murray, actually, just on the note that you were just talking about. Do you have a number of how many calls you guys have gotten so far as people actually reporting dangerous conditions?
I don't. I know we get, many calls to the region's call center. I just don't know how many of those are, actual complaints about, people congregating. So we're getting calls. The other thing I do know is the city and township bylaw enforcement people are also getting calls, as are Waterloo Region Police. So calls are going to multiple places. All the enforcement people, local bylaw officers, regional bylaw officers, and police and public health inspectors are all working closely together behind the scenes to make sure that the right people respond to the right calls. So I don't have the answer about number of calls. And it's hard to get that accurate number because calls are going to different places.
Of course, that makes sense. Do you happen to have do you have an update on any amount of increase in charges toward businesses that were operating that shouldn't have been, or people who wouldn't comply?
Yep, so I think to date, the region has laid 1 charge, and I believe the city of Kitchener laid 1 charge last weekend. So that's all I've heard about to date. And, I also would say, and I think we've said this a number of times, our goal is compliance. Our goal is not necessarily to lay charges. So we want people to be complying with the guidelines, complying with the regulations. So if that can happen easily through a warning, that's great. If it requires enforcement action and, formal warnings and charges, then so be it.
All right, thank you.
Thanks, Ben. I will pass it over to Irene from Air News. Irene, go ahead with your questions.
No questions at this time, but you said that we will have a meeting on Friday morning, right?
That's correct. Same time.
Great. Thank you.
We'll be sending a link out ahead of time. All right. So over to Kevin from Global. Can you hear me, Kevin?
I'm good. I'm good.
There you
No
go.
questions today.
No questions. All right. So that leaves Nicole from CTV. Go ahead, Nicole.
Hi, good morning. Give me
Morning.
one quick second. Previously, Dr. Wang, you talked about people that you were monitoring. Do you consider those probable cases that have not been tested, and is there any tracking of those happening?
Oh, yeah. So I'm not reporting on those anymore. You're right. I mean, we're continuing to monitor an increasing number of people, because basically who we monitor are those that have been tested and for whom we're waiting those results, and whom have tested positive. And, we've asked to self-isolate, and we check in with them regularly. So the number keeps increasing, but I just think it's not a number we have a lot of priority numbers to get out, so we're focusing on those other numbers. But that's what we mean in terms of number of people that we're monitoring. Now, there's a lot of people out there who can have mild symptoms that can be due to this or other things, because we're still in flu season. We still regularly get results, whether it be in whether it be in people or in homes, long-term care homes, retirement homes, where the organism is not COVID-19, right? So there are other organisms, common viral ones, influenza, that are still circulating. So there are a lot of people out there who may have symptoms and who may have it, but have milder symptoms, and who are not being tested, and whom we ask to stay home and self-isolate from 14 days from the start of their symptoms. So these will not be people that go into our formal counting system. But the important thing for everyone, whether we are formally tracking them or we have asked them to stay at home and self-isolate until it's been 14 days since the start of their symptoms, is that people do that. Is that if they have symptoms, they don't go out, they don't go to work, and they self-isolate. And if people continue to do that, then we will continue to see, this manageable curve of new cases.
Is there any consideration to perhaps include these numbers of people that you have not tested but are exhibiting symptoms? Because I think that would be, I guess, a more fair. You can?
We can't track it. We can't track it because it can be people that, they've heard our message, they're staying at home, they're recovering by themselves, it's going well. We won't necessarily know about them. As I kind of mentioned to Kate, while it would be ideal if we had enough, testing capacity, if we had enough resources in the healthcare system to track every single possible case, it is not essential for us to track all cases to be able to follow the trends. So we do, the confirmed cases are, a good indicator, even if they're not perfect, and we wish we could confirm more cases. And the hospitalizations are another indicator, and the deaths as well are another indicator. So overall, we still have indicators that we can track to track how it's going in our community, in our healthcare system overall. And we do have a limited, number, as always, of healthcare capacity, healthcare personnel, and we need to continue to focus the work of that personnel on those, priority groups that we are testing and managing. So that's kind of the long answer to that question.
Okay, and just checking in on the local projections,
Mhm.
wondering if you have been able to work on that modeling.
Yeah, we are working on it. So we hope to be able to release that soon. I just say we were constantly working, and we are definitely working on that.
Okay. And one last question.
Mhm.
We've had a number of healthcare workers calling in, emailing into our station, expressing concern about the lack of PPE when they are at work. In those instances, if they are concerned that is this something that they should address with their employer, or if they are scared of losing their jobs, can they approach public health about this?
They would need to go to their employers, because their employers know their work situation. Public health wouldn't know those specific work situations. Public health also has is not involved in the supply chain itself. So, even if we came across excess masks, we would have to give it to the prioritized health settings. So we cannot, I know there's sometimes, and understandably, people might think, oh, public health might have masks, or if I tell public health may be able to, help me. But really the best place for these employees to go is to their employer, who knows their employee situation. We do know there are limited supplies across the province. There has been guidance provided by experts at the province in terms of what is needed by whom and when. And those guidelines have been provided to hospitals, long-term cares, we know that we need to be very good stewards of personal protective equipment during this time. But the organizations receive this guidance about how to properly conserve personal protective equipment, at the same time as ensuring that their staff have sufficient equipment in order to be able to protect the patients and themselves.
That's it.
Thanks, Nicole. Okay, I will give everyone one last chance to chime in, or I'm just checking to make sure I got everyone. Kate, do you have a final question?
It's like I ever have a final question. I'm not sure whether this is something Chair Redman can speak to, or Dr. Wang. We've seen a lot of cases lately of people deliberately spitting or coughing on people who are working. And I'm wondering if there's any, other than don't do that, that's gross. I'm wondering if there's any comment on this trend that, like, we've had at least 3 things lately, one in Guelph, one in Waterloo, one in Stratford, where people are doing this. And I guess I'm just wondering your thoughts on that. And Dr. Wang, I can see you just shaking your head, because
Yeah.
I'll go first, and then Dr. Wang can give the right answer. Kate, it is absolutely reprehensible. I mean, it is an act of assault, and I think some of the cases that you referenced actually are being pursued by the authorities, by the police, because of that. The reality is there's a very fine balance. I think there's people in the community that are a bit frustrated that we keep giving advice rather than orders, and we keep saying practice physical distancing, but we aren't coming down really hard. As Mike Murray pointed out, we have the tools to enforce if we need to, but we recognize that this is an atmosphere of fear. And it's hard to say what would motivate somebody to spit on another person. It really is a pretty reprehensible thing to do. But we also recognize that there's a balance between getting people's attention, taking this advice seriously, because what each of us does and all of us do collectively makes a huge difference, as Dr. Wang has pointed out time and time again. But it's the same as giving people, bylaw officers or police giving people a $750 ticket. We recognize that this is a time of huge financial uncertainty for so many people. And we also recognize that we're social beings, so being isolated is a difficult thing to continue to do. But we know COVID-19 has been with us for a while, and we know it will continue to be with us for a while. And so it's really striking that balance. Dr. Wang, I don't know if you want to jump in.
Yeah, I heard about that elsewhere, but I'm sad to hear that it can happen here too. Yeah.
Don't spit.
Yeah, well, yeah, anyways, I know that there are lots and lots of good people who are trying very hard, even through personal sacrifice of their own, to help our community. And I think you know what? I just want to thank them.
Yeah, thank you.
Thank you both.
Okay, I think that's it for questions. I don't think I missed everyone, so we're going to wrap it up. Thanks again, guys, for your support. We really, really appreciate it, and we will see you on Friday. Okay.